Hello, the purpose of this video is to review what to expect now that your surgery is complete. It is important that we review deep breathing and coughing exercises with you. This will help clear your lungs and prevent pneumonia after surgery. This is your incentive spirometer, or IS. To use this, place the mouthpiece in your mouth. Breathe out normally, then breathe in slowly. Your goal should be to make the disc stay in the middle of the chamber while you breathe in. Breathing in will also make the larger disc in the middle rise. Try to make this disc rise as high as you can. If you breathe in too fast, the disc will shoot to the top of the chamber. If you breathe in too slowly, the disc will not rise. You should do this exercise 10 times per hour. Another breathing exercise you should be doing 10 times per hour is pursed lip deep breathing. To do this, breathe in slowly and deeply through your nose, then breathe out slowly through your mouth with pursed lips. Once you have finished your breathing exercises, you should cough 2 to 3 times. To do this, hold a pillow against your incision. This helps support your incision. Cough strongly 3 times. If your cough is wet, try coughing a few more times to clear the phlegm. Now let's talk about eating and drinking. It is safe to drink fluids the night of your surgery. It's also safe to have food the day after your surgery. You may not feel hungry, but most patients eat and drink more each day. Your first meal will be given to you the day after surgery. As your diet is advanced, soft foods like scrambled eggs and mashed potatoes may be easier for you to eat. You should sit up in a chair with every meal, no matter how much or little you eat. You should not push yourself to eat. Eat when you are hungry and feel ready. Let your nurse know if you get sick to your stomach or feel bloated while eating or after eating. You should chew 1 stick of gum for at least 5 minutes 3 times per day. Chewing gum may help you pass gas. This is a sign that your bowels are working. Sometimes after your surgery, your bowels may stop working. This is called an ileus. Some signs and symptoms of an ileus are nausea, vomiting, and feeling bloated. Tell your nurse if you have any of these signs and symptoms. Pain medication can increase your risk of an ileus as well. Walking and chewing gum may help your bowels work faster after surgery and reduce your risk of an ileus. After surgery, you are at increased risk for blood clots. Getting out of bed and walking helps reduce this risk. The Progressive Mobility Program at Winchester Medical Center is designed to increase your activity level while you are in the hospital. The Progressive Mobility Program has 7 steps: bed rest, bed exercises, bed mobility, sit on side of bed, chair, walk in room, walk out of room. Your care team will help determine which step of the program you start at and what your goals are. While you are in bed, there are some exercises you can do that will further reduce your risk of blood clots. Ankle pumps. To do this, bend the ankles up and down, alternating feet. Repeat this 10 times every hour while you are awake in bed. The next exercise is a knee press. Slowly tighten muscles on thigh while counting out loud to 3. Repeat this 10 times every hour you are awake in bed. Gluteal squeeze. Squeeze your buttocks muscles as tightly as possible while counting out loud to 3. Repeat 10 times every hour you are awake in bed. In addition to these exercises, here are a few other things you can do while you are in bed to help restore your mobility. Move your legs and arms frequently. Change your position at least every 2 hours. Help with your self-care activities such as bathing, grooming, and dressing. If you are unable to actively move your arms and legs, your family and caregivers will be educated on how to help you. Now let's talk about some things you can do while you are out of bed to help restore your mobility. Be sure to sit up in a chair for all your meals. Use the bedside commode or walk to the bathroom if you are able. Stand at the sink to wash your hands and brush your teeth. Walk to the door or down the hallway as able. It is normal to feel nervous about getting up after your surgery. Your nursing staff is here to assist you with your mobility. They will help you with your IV poles and tubing while you are walking. Be sure to ask your nurse what activities you can safely do with or without assistance. We do not want you to fall. After walking, it is normal that you may feel more tired than usual. Your body is healing, so be sure to rest after your walks. Pain is normal after surgery. Having your pain controlled is an important part of your recovery. It helps reduce stress in the body. Perform your deep breathing and coughing exercises easily, move easily, and sleep better. Oral medication will be given to you around the clock. It is important to take this even if you are comfortable. If you are still uncomfortable, other medications can be given. A number scale is used to help you decide when to do something about your pain. The scale ranges from 0 to 10. 10 is the worst pain you have ever felt. Your nurse will discuss your goals with you to help manage your pain. Now let's talk about what needs to happen before you can safely be discharged to home. You should have no nausea or vomiting. You should be passing gas. You are not required to have a bowel movement before you go home. You should be able to get out of bed on your own. You should be walking like you did before you had surgery. However, it is normal not to be able to walk as far as you did before surgery. Your surgeon will decide on any weight restrictions. When you are home, you should continue to walk and be active. You should gradually increase your activity level over the next several weeks. You may drive when you are no longer taking opioid medication. Your surgeon will tell you when you can return to work. This is dependent on what kind of surgery you had and the type of work you do. You can shower as instructed. Do not submerge your incision underwater. Therefore, no baths, hot tubs, rivers, or pools until cleared by your surgeon. If you go home with staples holding your surgical incision together, your nurse will talk with you about when they need to be removed. There are some signs and symptoms to watch for once you are discharged home. If you have any of the following symptoms, call your surgeon or go to the emergency room immediately. A fever greater than 100.5 degrees. You are bloated, nauseated, or vomiting frequently. Redness, swelling, odor, pus, or increasing pain from your surgical incision. Stomach pain that medication does not help. You have not had a bowel movement after 7 days following surgery. Difficulty breathing. Redness, swelling, or pain in one or both of your legs. Thank you for your time.